So if there's one thing we can agree on, it's that the COVID-19 pandemic has been bad, really bad.
This is the worst public health crisis for a generation.
Globally, more than 2.6 million people have died, and the IMF calculate that it will have cost the world $28 trillion. There's a second thing that experts agree on, and that is future pandemics will occur. In fact, zoonotic events, the events that cause pandemics, are becoming more frequent. So what have we learned over the last 12 months, and how will we protect ourselves from pandemics in future? So I think our biggest mistake in the UK was not planning in advance to stop a new novel virus. Countries like South Korea, Taiwan, even China had suffered previously from SARS and MERS, and they knew the chaos that they could cause. So they planned in advance if a new virus broke out. In the UK, in contrast, like so much of our health, we didn't focus on prevention, we focused on treatment, and it's turned out to be a very costly mistake. So countries that stopped the virus early have not only suffered much, much lower deaths, but they've also avoided lockdowns either entirely or at least they've limited lockdowns dramatically. So if we're going to stop future pandemics, the first thing we've got to get right is our radar, our eyes and ears, and that means testing.
We have a simple message for all countries: test, test, test.
The UK had nothing like enough testing capacity, and it meant that we didn't really know the extent to which the virus had invaded. Contact tracing and isolation is our first defense. We didn't have the tracing and isolation facilities needed to track down all those early cases.
You must test and isolate.
We dropped the isolation, so we talk about a test and trace system. But that's to take the third leg off the stool, and without a good isolation system, the stool collapses. And that's what's happened in the UK. While countries around the world have been careful to help people isolate, to provide hotel rooms, to provide hot meals delivered to their doorstep, to provide financial compensation. In the UK, we haven't done that, and it's resulted in people intending to isolate at quite high levels. 60–70% say they intend to isolate. But the reality is, according to many surveys, that actually only about 18% of people with symptoms really properly isolate.
From this evening, I must give the British people a very simple instruction. You must stay at home.
We definitely locked down too late. Boris Johnson has apparently admitted this to colleagues. I don't think it's much of a surprise. The lesson with lockdown from around the world is that if you act early, very early, to distance people and instigate perhaps some closures, then you're in a much better position in the long term to allow freedoms and businesses to flourish. Countries like New Zealand, Australia, Taiwan, South Korea have really functioned as normal for most of the last year, although at the outset they had to take some pain. The biggest irony is that Britain has been locked down much, much, much longer than countries like Taiwan and South Korea. It's really important to realise in the UK and most Western countries, these lockdowns have been driven not actually by the number of cases and deaths, but by the capacity of our health systems to deal with it. In hospitals, we ran our system very lean. We had very few beds compared to others per head of population. So one lesson going forward is that we're going to have to build resilience into our system. We're going to have to build additional capacity that we might not use in normal times, but we have there to rely on in case of a pandemic. Borders and travel are a really contentious area, and that is going to be a priority for Britain in the next pandemic. Our airports are going to have to look different. They're going to have isolation rooms. They're going to have stocks of PPE. There is good evidence to show that unless you lock down all airports completely, you stop flights in their entirety, you are still going to have an import of the virus, no matter how good your checks are. So that is a difficult question for a country like Britain going forward. We're a global hub, huge amount of travel in and out, and perhaps with a quick, short, sharp lockdown on travel to begin with, we can prevent restrictions going forward. Pandemic wargaming is something the country should be doing every year. These war games not only test how a virus might spread through society and test society's capacity to deal with it, but really importantly, if conducted openly, they show the public the sort of choices that would need to be made if a real pandemic broke out. And if Operation Cygnus, the war game that was run in 2016, had been conducted openly, people would have seen the virus swept through society and wasn't stoppable. So looking forward, am I optimistic? Will we have learned the lessons? I suspect we will. Not, I think, because I'm certain politicians and officials will embrace the lessons of this, but I'm absolutely sure that the public who has lived through it will. I think you see that really clearly in these Asian economies. They were hit hard by SARS and they learned, and we can see they've come out much better from this pandemic. And I'm sure the same will be true of the UK and other Western nations in future.